In this video, we'll learn more about how to get ready for Community Information Integration Central Patient Attachment Registry. There are 4 prerequisites for participation in CII-CPAR. The clinic needs to be live on Alberta Netcare, with a privacy impact assessment that is up to date. The clinic EMR needs to be conformed for CII-CPAR. And for those clinics that are submitting panels, the clinic needs to be panel ready. We know that most clinics in Alberta are live on Alberta Netcare, including 77% of clinics in primary care networks. If a clinic is not live, to learn more how to register for Alberta Netcare, visit albertanetcare.ca. Next, the clinic privacy impact assessment needs to be up to date. In other words, it needs to represent the current clinic environment. If a clinic is unsure if their PIA is up to date, there is a PIA Update Self-Assessment Questionnaire available on the Tools and Resources page. The questionnaire will tell the clinic if they need to update their PIA and if it needs to be updated, if it is a minor or a major update. The reason a clinic does not need to do a brand new PIA has to do with the fact that there is a PIA submitted to the Office of the Information and Privacy Commissioner for the CII project. A custodian needs only to endorse that PIA to participate. A copy of the project PIA as well as an example endorsement letter are available on the Tools and Resources webpage. Next, the conformed EMRs. As of spring 2019, MicroQuest HealthQuest, TELUS MedAccess, TELUS PS Suite, and TELUS Wolf are all conformed. QHR is in development and will be conformed in the summer of 2019. ConnectCare is next. The 4th requirement for clinics submitting panels to CPAR is that panel readiness is in place. Every checkbox on the panel readiness checklist needs to be checked off. There needs to be a responsible person. There needs to be processes established for panel identification as well as panel maintenance. Also, there are some intention to participate that needs to be checked off. If all boxes cannot be checked off, it is recommended to use the supportive tools for every panel documents. More information is on the CII-CPAR Tools and Resources webpage. Now that we have a bit of an understanding, let's look at who can participate in CII and CPAR. Let's first understand the difference between a panel and a caseload. A panel is a group of patients for whom a primary provider and team is responsible for providing comprehensive and longitudinal care. There is a confirmed relationship between the primary provider and the patient. A caseload is a group of patients under the care of a specialist. Community primary providers and specialists are all invited to participate in CII and CPAR. First, let's look at a family physician with a defined panel of patients. That physician can participate and submit panels to CPAR and the select mapped encounter information to the Clinical Encounter Digest in Netcare through CII. To learn more about the Clinical Encounter Digest, please see the video on how CII-CPAR works, as well as the example CED available on the Tools and Resources webpage. A nurse practitioner with a panel can participate and submit panels to CPAR and encounter information to Alberta Netcare through CII. A pair of providers that share a panel of patients can submit the panel information to CPAR and encounter information to Alberta Netcare through CII. A physician with both a panel and a caseload can participate. The panel can be submitted to CPAR and both encounter information and resulting consult reports to Alberta Netcare through CII. A physician that doesn't have panels can participate as well. In this example, a physician working in a PCN after-hours clinic can submit the encounter information to the Clinical Encounter Digest in Alberta Netcare through CII. A pediatrician with both a panel and a caseload can participate. The panel can be submitted to CPAR, and the encounter information and consult reports can be submitted to Alberta Netcare through CII. And finally, a specialist that writes consult reports can participate. Encounter information can go to Alberta Netcare through CII, and a PDF copy of the consult reports can be submitted to Alberta Netcare. To learn more, please visit the CII CPAR webpage or albertanetcare.ca.